and members of the Senate Education Committee. I am Dr. Laura Haynes, psychologist and a 40-year member of the American Psychological Association. My specialty, since I retired from clinical practice, is reviewing research, and I am called upon for research by various organizations, including Protect Our Kids in California and the American College of Pediatricians. I am here because I want to help you protect Arizona children and parents from the huge problems we face now in California, where parents' rights are being eroded in a major way, and children are viewing explicit sex education material way too early and having experiences that psychologically traumatize them. I will give only a few examples of the serious problems in California and what can happen in Arizona, and then I will present research. In Los Angeles, second graders have been taught sexual body parts in a mixed classroom of boys and girls. They have been shown images of penises and clitorises and been taught the clitoris is sensitive to direct and indirect touch. For students as early as 4th grade and up, sex education has included vulgar cartoon pornography videos that tell children that using porn is normal, teach that masturbation is a way to relieve stress, and tell children how to decide whether they are ready to have sex. A school teacher in San Diego, Ashley Beaver, accurately described one cartoon porn video called Porn Fact or Fiction, also titled Banana Pudding. In it, nude cartoon characters Julie Mellons and Miles Long were depicted in pornographic situations, including in bed. The video tells its young audience that looking at pictures of films or naked bodies or people engaging in sexual behaviors is perfectly normal. The video ends with a cartoon child smiling as she looks at a computer screen and says, "I wonder how long the longest cucumber in the world is. Hey, that's not a cucumber." Regarding parent oversight, in California, some schools have not sent opt-out notifications to parents, and parents have not been able to protect their children. If parents had to opt their children in, these catastrophes could be averted. Serious problems can happen in Arizona if you don't have the kinds of protections of SB 1082 in place and parent supervision over what is being taught to children. When it comes to children, protection is always best, and we wouldn't have it any other way. Now, my expertise is in research that relates to sexuality. I want to read to you some compelling statistics from the United States Government Centers for Disease Control and Prevention, CDC. I think we can all certainly agree that data from the CDC is widely respected and considered reliable. A comprehensive study by the CDC found that, nationwide, high school students who were never sexually active, whatever their sexual orientation, were far better off in many respects. The Youth Risk Behavior Surveillance United States 2017 survey looked at students in public, charter, and non-public schools. Researchers discovered that many students across sexual orientations were not sexually active. They reported nationwide 45% of students had had sexual contact with only the opposite sex, 2% had had sexual contact with only the same sex, 5% had had sexual contact with both sexes, and the largest group, 48%, had had no sexual contact. Nationwide, among students who had no sexual contact, about 87% identified as heterosexual, 8% identified as gay, lesbian, or bisexual, and 5% were not sure of their sexual identity. High school students, whatever their sexual orientation, who had no sexual contact, were far less likely to feel sad or hopeless for 2 weeks in a row, or seriously consider, plan, or attempt suicide. Use alcohol, tobacco, cocaine, inhalants, heroin, methamphetamine, ecstasy, hallucinogenic drugs, steroids without a doctor's prescription, prescription pain medicine without or not following a doctor's prescription, or any illegal drug, be a victim of bullying, forced sexual intercourse, or sexual or physical violence by anyone or by a date, engage in risky behavior, ride in it with a driver who had been drinking alcohol or using marijuana, drive when they had been drinking alcohol, text while driving, or engage in behaviors that contribute to violence, carry a weapon or gun, or be in a physical fight. While this research cannot tell us what factors may have been causes and what factors may have been results, it does reveal that high school students who sexually abstain, whatever their sexual orientation, are safer and better off by far. And this is true even before we mention the self-evident advantages of reproductive health and pregnancy prevention. It should be obvious that sexual abstinence ought to be a primary goal directing sex education. Desensitizing second graders to images of boys' and girls' sex organs and teaching them that they are sensitive to touch is titillating towards sexual exploration and activity that is not in their interests. Further, any messaging that normalizes sexual activity for children or adolescents or leads students to believe it is expected is counter to the goal of healthy youth. These comprehensive national health data support what most parents believe. No children or minor adolescents, whatever their sexual orientation, need to be having sex. Sex education should help sexually active students to return to abstinence and abstinent students to remain abstinent. If we had had SB 1082 in California and the provisions in it that spell out parental rights, spell out opt-in and notification, protect children from exposure to sexual material they are not ready for, teach that abstinence is the expected standard that has to be emphasized, encourage sexually active kids to return to abstinence and abstinent children to stay abstinent, we would have been able to protect so many children. We are now having to reverse our laws and protect our children. You have a chance to head off problems of sexualizing children and eroding parents' rights we are trying to undo in California. This bill makes complete sense. And please, I urge every one of you in this committee to move forward on these protections for children and for parents of children of all sexual orientations. Thank you.